Sexual orientation and gender identity is still very much stigmatized. It's very hard for people to get support in terms of living authentic lives. And this is part of my role in helping people so that they can get support within their families and communities. APICHA started in 1989 by Asian activists who were looking for services for HIV-infected people. In the late 80s, and this was before the Ryan White Care Act that President Clinton promoted in 1990. He started that, but this is before the Ryan White Care Act, when there was not that much advocacy for Asian and Pacific Islander populations. There were so few services, and HIV was very stigmatized in the Asian community as well as other communities, that it was hard to get people to access treatment. People were not really coming into medical care until they were hospitalized often. APICHA found it necessary to do outreach in the community, to educate people, to educate the community about the need to come into HIV services. And as we started to do this, we were finding that there were other people who were not being served because of their sexual orientation or their gender identity. And we started to conduct a lot of outreach so that people would avail themselves of medical care and to learn about prevention. After all, HIV is a preventable disease, but it takes a lot of education and outreach in order for people to really learn about the possibilities that exist, especially here at APICHA. But as you start to offer services to people, you find that you need to deal with disclosure of sexual orientation, disclosure of gender identity, and these kinds of psychosocial issues that make it very difficult for people to openly talk about their illness and how they're going to get support from their families and communities. Sexual orientation and gender identity is still very much stigmatized in many communities of color, and therefore it's very hard for people to get support about what they are doing in terms of living authentic lives. And this is part of my role in helping people to talk openly and to disclose their sexual orientation so that they can get support within their families and communities. At the same time, I have to be very mindful that communities are not just the communities here in New York City. Many of the immigrant communities have ties to their home countries. Through the internet and Skyping and all other instant communication, word can get out to communities in countries of origin that then make it very problematic, not only for the patients who are being seen in our clinic, but also for patients' families who continue to reside in the countries overseas. When people are in these very difficult situations, such as fleeing persecution or trying to come to the United States for better economic opportunities, they're very much alone. And any kind of support that is available through their communities and families becomes very precious. It becomes very important. And we have a lot of activities here at APICHA Community Health Center to try to foster that sense of belonging and community. We are really providing robust services to complement the medical services. That is, we provide such things as case management that includes home visits to see if people are adhering to their treatments. We provide food and nutrition services. We provide referrals for legal services for people who are seeking asylum from their home countries for political and reasons, sexual orientation and gender identity reasons. We're very much at home in the communities. We are here on the border. One side is Chinatown with its many immigrant communities, not just people from various parts of China, but many Malaysian, Indonesian, Vietnamese, Thai, Singaporean, Pakistani, Bangladeshi, and people from all parts of India are here in this community. And on the other side, we have people from Tribeca who come here for medical care. We try to serve many people on the Lower East Side who are also immigrants from various parts of Mexico, South America, Latin America. All of these populations come here and find a great deal of comfort, I hope, in accessing care here. If you look at HIV, HIV is a disease of the entire system. If you really look at the medical implications of HIV. Also, it has a lot of, HIV has psychosocial implications. Collaboration is needed in working with different people in the community, as well as collaboration with family members and significant others of the patients and clients that we have here. It is a total services model that incorporates not only the individual and not only the individual's medical condition, but it's the mental health processes, the intrapsychic life of the person, as well as their whole social environment.